My brothers and sisters, good night. Good night to all brothers and sisters from Dennery South. And a while ago, Sister Lisa Jawaher introduced the head table, not the head table, but the round tables that we have here. Our political leader and prime minister, also officials of the party. But I wish to greet everyone inside of here tonight, but also I wish to greet everyone who has joined us on social media. Let's give them a round of applause. My brothers and my sisters, I'm here tonight to join my comrade, my brother, Alfred Prosper, the Honorable Alfred Prosper. I'm here to join who we know as Tabach, and a man who fights for Dennery South in the Cabinet of Ministers every single Monday. I'm here to join him tonight to say to you, the people of Dennery South, and to the people of Saint Lucia, that we are delivering on our promises to the people of Saint Lucia, and we continue to put you first. And Tabach, Alfred Prosper, continues to put the people of Dennery South first, my brothers and sisters. We are delivering on our promises, and every single week, every single month, the Prime Minister demonstrates to the people of Saint Lucia that we are very serious about delivering on our promises. I'm sure you will hear tonight many speakers who will tell you about how we continue to try to deliver on our promises. Moi siwe ou kaitana chayoswea, ale ki manière Premier ministre Philippe J. Pierre avec cabinet là ka délivrer ale se promettre là qui nous te fait là nous te ka campagne. Combien promettre nous fait? Nous garder les affaires santé, les affaires infrastructure, nous a gardé les affaires commerce, les affaires business, les affaires jeunes moun, les affaires grand moun, les affaires retirees, les affaires gens qui ni go business. Every single sector in Saint Lucia has felt the results of our work. And I want to give all those who continue to work hard with the government of Saint Lucia, whether they are public servants, whether they are in the constituencies, and everyone who continues to work with the government of Saint Lucia to ensure that we deliver on those promises. Let's give them a round of applause tonight, my brothers and sisters. We thank you very much. We thank you because we know you are not listening to those who tell you it is time to fight war. We thank you because we know you are sharing with us the dream of a better Saint Lucia. And we continue to deliver with the people, for the people, my brothers and sisters. In the area of healthcare, we continue to deliver for the people of Saint Lucia. I want you, my brothers and sisters, to picture July 2021. And for a moment, for a very brief moment, I want you to go back to July 2021. That was a time in the middle of the COVID-19 pandemic, the Delta variant. Unfortunately, people are getting sick, people are passing away, and the government of the day arresting you if you don't have a mask. The government of the day have police officers running behind you everywhere by Bassin Glow. The government of the day, have people in the respiratory hospital, they cannot communicate with their relatives, difficult to get food to them, difficult for them to know what's happening in the world. I want you to think of July 2021, when the government was forced earlier in the pandemic to move the Victoria Hospital to the Owen King EU Hospital without a proper transition plan. I want you to think about that. I want you to think of that time in July 2021, when every time we asked the Prime Minister questions, he would call us jackasses and barking dogs, and no one can tell the government what to do. That was July 2021. I want you to think about that and to understand where we are coming from. I want you to understand, my brothers and sisters, that the government at the time listened to no one. They listened to no doctors, no nurses, no one at all. I want you to think of July 2021 and think of the state of the St. Jude Hospital, when instead of completing the hospital, they decided to build an edifice. They lied to us and said it was almost finished, and they put pictures on Facebook, and they did something to the roof. Afterwards, we realized that there was no roof at all. I want you to think of that time. It was not so long ago. And we promised you that we would create a different health system in Saint Lucia. We knew that it was a difficult challenge. Nous savons tout partout en l'autre pays, Amérique, Angleterre, Canada, tout partout là ni difficulté à sortir. We knew that, but we promised that we would change the atmosphere in healthcare. And in the middle of all the difficulties, in the middle of all the challenges of the COVID-19 pandemic, we rolled our sleeves in the cabinet. We rolled up our sleeves with the help of doctors and nurses and ordinary St. Lucians, the firemen, the police, and everyone to change the situation with healthcare in this country. We went to the OKEU and we realized that the hospital was not transitioned properly. We realized even then that the structure of the buildings in the hospital had difficulty. We realized that the government did not even provide enough money in the budget for the transition from the Victoria Hospital to the Owen King EU Hospital. We went to the Victoria Hospital, the respiratory hospital, to find individuals not given the resources that are needed for proper care at the respiratory hospital. What did we do? What did we do? We went into the respiratory hospital. We worked with the telecommunications companies, and we caused there to be communication. We caused there to be Wi-Fi. We caused there to be means for the patients to communicate with their relatives, my brothers and sisters. We went in there and we worked with the doctors and the nurses, and we caused there to be new facilities that would have the doctors and the nurses to monitor the patients electronically at one central station. We went in there and we decided that we could not have sick people in a situation like that, and the Prime Minister decided that we need to institute what we call patient welfare assistance, my brothers and sisters. And we employed patient welfare assistants at the hospital to help those people, to cause their food to go to them. When relatives came to them, to cause the supplies to reach them, to cause there to be communication between the community and the patients, my brothers and sisters. We did not just stop there. From July 2021 up to the end of 2022, we were dealing with the COVID-19 pandemic, the Delta variant. So it was closing of the country, protocols. You saw me on television all the time. Some friends of mine said, oh my God, another protocol is coming. But as a government, we changed the laws to ensure that the laws were more humane and that the authorities treated people with more dignity. We were not arresting people everywhere because they didn't have masks or this without care. What we did, we caused there to be compassion with the dealing and treatment of COVID-19. And many people predicted a lot of things. The UWPs were saying that people would die in corridors everywhere, my brothers and sisters. They said, we have no expertise to deal with it. But we called on Saint Lucians. We called on Saint Lucians to assist us. And we called on Mr. Springer and his team. And we called on ordinary Saint Lucians to help us to help us. And we dealt with that situation, my brothers and sisters, and we came out of COVID-19 suffering a lot, with a lot of pain, but we brought the country back to production and back to development, my brothers and sisters. We promised you in the campaign that we would institute universal health coverage. I heard the opposition saying there is no universal health coverage. What is universal health coverage? Magie. For decades, my brothers and sisters, since 2005, there are documents in the Ministry of Health and in the government which speak about universal health coverage. All kinds of studies and professionals and all kinds of people. And everybody knows what to do, but we know to do what we have to do, we need hundreds of millions of dollars. So what did we do? In the past, we instituted assistance for people with diabetes. So suit any diabetes, we made it free about Dennery gouvernement labor Dr. Kenny Anthony Yokuma Sisa. Mais la teni un plan pour faire universal health coverage. Mais malheureusement, nous perdons l'élection. L'autre gouvernement venu, and when the other government came in, they stopped the program. When we came back to government between 2011 and 2016, more discussions. How are we going to do universal health coverage? By the time discussions are going on, nous perdons l'élection encore in 2016. When we campaigned, Honorable Philip J. Pierre, Prime Minister, said, regardless of what happens, we are going to start universal health coverage as long as we win the government, my brothers and sisters. And so when I was made Minister for Health on the 6th of August, 2021, my instructions were, start universal health coverage. I don't know how you're going to start it, Musa. Get your professionals together and bring benefits to the people of Saint Lucia. And so while we are talking about financing, how are we going to finance this $500 million project or so? Decades and decades and decades, the people are suffering. And we are taking 40 years to decide how to do it, and nobody ain't really doing it. So we say, we're starting it. The cabinet agreed we are going to have a universal health coverage unit in the ministry. Bam, universal health coverage unit. We agreed we are going to start small. Bam, we started with pregnant ladies with maternal and child care. Today in Saint Lucia, any pregnant lady who wants the service, you go to the health center and you get all your ultrasounds, all your blood tests, free of charge. You go to the health center, you register, and you get a voucher. You're examined, you get a voucher, and your blood tests and ultrasounds are done in the private sector. So we partnered with the private sector. Those medical professionals who have labs and so on, Dr. King and all of them, we partnered with them, signed contracts with their businesses, and we are doing the tests with their businesses, with the hospitals, OKU and St. Jude. We are delivering on our promise to you. So while we are waiting for the complete universal healthcare package, we are delivering services, my brothers and sisters. I went to cabinet again, and my comrades in the cabinet, when I presented a paper from our doctors, Dr. Alicia Eugene Ford and her team, and the PS and the team, my comrades in cabinet said, great idea. We said, pregnant ladies, that's not enough. Our government decided that we are going for cervical cancer. And a new method of cervical cancer or testing cervical cancer was introduced. And today in St. Lucia, you can get this new method at our health centers, and you can get consultations free of charge, no cost to the people of St. Lucia, my brothers and sisters. We did not just stop there. The Prime Minister said we must go further because we do not yet have the whole package, but we want to deliver services. We said no, not just the ladies and the pregnant ladies. We are going for prostate cancer. And our government decided that we would fund prostate cancer examinations. We are going to add it to the men's clinic, and we are going to have PSA tests done without any cost to the men of Saint Lucian, my brothers and sisters. So I encourage all men, as long as you are 35 years, go for your PSA test, because prostate cancer kills, unfortunately, many men in Saint Lucia, my brothers and sisters. And we did not just stop there. We said, my brothers and sisters, that we are going to expand breast cancer screening. We are going to introduce all the machines in the primary care sector so that our people can have greater access to health care. We continued with the PBF program, and this program, funded by the World Bank, has spread in some pilot health centers around St. Lucia, giving additional numbers of St. Lucian's medication. Let me give you a brief example. When we came into government in July of 2021, in the public sector, in the primary sector, we were giving 2,100 people free medication. Listen to me well. 2,100 people. And they can fact check it. Today, over 25,000 St. Lucians are getting free medication, my brothers and sisters. And this can be fact-checked. Because of the new programs, many more St. Lucians are getting free medication. We have expanded services at the health centers. We have provided new equipment, basic equipment at the primary care centers. And we are continuing to work on our hospitals. I cannot leave if I don't speak about our hospitals. The OKEU hospital, my brothers and sisters. The OKEU hospital started its functions in March of 2020. The last government was forced to transition the hospital from Victoria Hospital because of COVID-19. They came into government in 2016, and they waited and waited and waited and waited. Nothing at the hospital until COVID-19. It's like COVID-19 kicked them into the hospital. And when they went to the hospital, there was a transition plan by the last Labour government with Dr. Stephen King. They kicked that transition plan, and they went into the hospital without a proper transition plan. They went into the hospital without proper budgets. They went into the hospital without the proper resources. And so the difficulties, my brothers and sisters, with medication, there was about $9 million or so owed to suppliers of medication to that facility. And what did they do? Instead of investing our money into the OKEU, you know what the last Prime Minister did? He signed a contract for $25 million over 2 years to give to his friends and a company to do a consultancy at the OKEU, my brothers and sisters. I want you to listen to me. $25 million, Jean-Pays Saint Lucie, dernier premier ministre, leader flambeau, ici avec un grand immun Jean, consultant, pour faire consultancy à l'hôpital OKEU. Là, il a des problèmes avec gas line, là, il a des problèmes avec space, là, pas assez space pour mes couches, là, pas assez lait pour mes couches. But he signed a contract, listen to that, for $25 million of our money, which this Prime Minister had to take a loan when we came into government to pay, my brothers and sisters. So you can see the difficulties. But we did not cower. Since we came into government, this Prime Minister has increased the budget to the OKEU hospital. Right now, it's over $60-something million, my brothers and sisters. That's what we have done. Then the Prime Minister came in with all the difficulties and the challenges, with doctors saying of the difficulties, and some of them choosing not to renew their relationship with the hospital. We met them in the cabinet room before all of this, and Prime Minister asked, what can we do Prime Minister, we need to do this at the hospital, that at the hospital. Prime Minister approved everything. $15 million was given to the hospital, my brothers and sisters. So if you have to compare which government is in the best interest of the people of Saint Lucia, it cannot be the other people. It has to be the Saint Lucia Labour Party, my brothers and sisters. And yes, of course, there are difficulties and challenges. Of course. There are difficulties and challenges. There are difficulties with enough. We don't have a number of our nurses. We need more nurses. Of course, we need more specialists. Of course, there are several things we are continuing to fix. But you can see we are delivering, my brothers and sisters. You can see clearly. You can compare us to them. When they are taking money and giving to their friends, $25 million, Prime Minister is taking $15 million and giving to our hospital for our people, my brothers and sisters. That is the difference. When they were there and there were difficulties with the hospitals, instead of meeting everyone and solving the problems, they were cursing us. They were calling us dogs. They were calling us useless. When we have a problem today, Prime Minister Philip J. Pierre calls everybody. He calls the doctors. He calls everybody. Let us solve these problems together. And so, my brothers and sisters, St. Jude Hospital is another example. And I can guarantee you that we are working diligently to deliver the St. Jude Hospital to the people of the South and the people of St. Lucia, my brothers and sisters. And very soon, before I say this, I'll take my seat soon. There's so much I want to tell you about health that I ain't even start yet. You know, Prime Minister always says to me, Minister, you know something? All of what they're saying about health in the media, the opposition, they're talking, they're saying all kind of things, they're demonstrating. They don't see you and I jumping up and fighting with them. You know why? Because the Prime Minister believes, we believe in the cabinet, and I believe when it comes to every sector, especially health, when people cry and they say there's a problem in the hospital, we are fighting politics with that. We roll up our sleeves and we get to the problem and we solve the problem. The time for us to fight with them on the platforms about healthcare is coming. In fact, that time has started. It's the records we have to show. Show me your record. I say to the Member of Parliament for Miku South, his Deriso Wellness Center. We have all the pictures of the state that he left the wellness center, the cupboards, and the Kakawa vet, and all of those things. We came in, we didn't quarrel, we didn't fight. We went to Deriso, we fixed the wellness center, and we called it the Lilia Haraxing Wellness Center, my brothers and sisters. From since when we were in government, in the Dr. Kenny Anthony administration, money was allocated to the Larishus Wellness Center after a fire, my brothers and sisters. The UWP government did not complete. They didn't do anything, according to Brother Sean. Not a bag of cement they burst by the Wellness Center, my brothers and sisters. The people were suffering. Quietly, Honorable Philip J. Pierre said, you know something? We are going to deliver to the people of Dennery North, because every single cabinet Monday, Honorable Sean Edward would talk about it, and Honorable Pierre said we are going to deliver it. Very soon, we will invite everybody to the grand opening. We have completed the refurbishment of the center. We are now finishing just the pavement on the outside, and we are equipping the Larishus Wellness Center with brand new equipment for the people of Dennery North and for the people of Saint Lucia. My brothers and sisters, that is the difference between them and us. We're not quarreling about health in the media. We know there are problems in health. And every single day, we get problems. Every day we get problems. We know there are problems in health. We know there are things we have to fix. But if you compare our commitment to the people of Saint Lucia and the actions, if you compare what we have done, not what we say we'll do, you know. What we have done. Not woulda, coulda, if I was there, I shoulda, woulda. They're all over the radio. If you hear him, we had an insurance card. Everybody should have an insurance policy for health. Ou te la passe 5 l'année ou pas fait. Ou te la passe 5 l'année ou pas fait. À présent, madame qui go boude ka jwen bagay. Prostate cancer, nom qui ay check prostate yo, ka jwen bagay. Toute qualité, cervical cancer. Et nous avons ek pli. Diabetes, hypertension. 80 plus, they criticize it. Yo di, c'est mon autre gouan, c'est mon autre presque mort, et c'est là nous kabayo bagay. Bêtise. You start somewhere, my brothers and sisters. You use the people's money, but you start somewhere. We try, we see all the difficulty, there are challenges. Some people, sometimes they go, they don't get the medication, they come back, we try again. The difference between us and them, they took our people's money and they gave it to their friends. We are taking the people's money and we are giving it to our people, even though we try and we try and we try and we try again. So very likely in the budget, we are discussing it, my cabinet colleagues and Prime Minister, they are very interested in bringing down the age from the 80, my brothers and sisters. Bit by bit. So while they criticize us, we are working to fix the problems, my brothers and sisters. And that is the difference. Yo devant Castries Health Center, ek placard, placard, bring back the Castries Health Center. I said something at the Dr. Betty Wells Polyclinic. Mwen di yo, tout se flamboa qui vle aller à Castries Health Center, ko ite avant, vini, nou ka ba yo office free of charge. If you want to go in there, Josh or Rosh or Kosh, whoever he is, if you want to go in there, come and we will give you office space. You can rush and don't rush, whatever you want to do. Because my brothers and sisters, we have reports. We have reports, and the reports indicate that that building is unsafe. You cannot have workers, health workers inside there and patients inside of there. And the UWP had that report too. So they want us to keep our St. Lucians inside of the Castries Health Center building. If they want the building, I'll give them an office space in there. But they don't want to go in there, but they want us to put the people in there. Let me tell you finally what we did. Prime Minister and the cabinet said, listen, we are not going in there. From 2013, there's been a plan to change the Victoria Hospital into an urban polyclinic. From 2013, we are government of action. We said we are doing it. And even though we can't do everything one time, we are starting. We went in there, and if you go there now, we have the Dr. Betty Wells Polyclinic, my brothers and sisters. If you go there now, we have brand new equipment for the St. Lucia Eye Center, which includes the Cuban Eye Clinic. And surgeries will begin shortly with brand new equipment, my brothers and sisters. And we have gutted the emergency where accident and emergency was. If you go there now, it's not if I shoulda, woulda, you know. You can go there now, tonight, and you can see it's gutted. We are going to have a brand new accident and emergency wing at that center, my brothers and sisters. So very soon, we are going to complete all of this work. We are going to cause the Dr. Winston Paris Medical Complex to function fully, and we are going to continue to bring services to the people of St. Lucia. At Grosile, we are adding a wing there. As you know, on Monday, work will start. at the Grosile Center. And more work is happening at Dennery. More work will happen with the CDB at the Dennery Hospital to convert it into a 24-hour facility with additional services. At Ciceron, we are hoping that we will have a brand new facility after the studies are done. So all around Saint Lucia, my brothers and sisters, we are working to deliver and we are working to improve the services. My brothers and sisters, the farmers, I want you to hold strain. I was Minister for Agriculture. Hold strain. We have challenges with the oil, and the minister is working, he will tell you. He's working. Many of my farmers are affected also. And the minister is working with the cabinet to cause there to be relief and to cause there to be a positive impact where that is concerned. I want to thank you, my brothers and sisters. To all of you, thanks. The people of VF North who are here and who are watching, thank you. I thank you for your support. And we have only just begun. Nous just commencé. Pas parler pour les nous kay ouvert Saint Jude. Aïe, bon Dieu. Many yon de moun New York ki di mwen yo zage had yo. Just di yo dat la bonne. Plane load. Masav si Dr. Ernest ile kaisa. Ni le airport. He went over pour buy sa. So we are going to deliver. But thank you very much, my brothers and sisters. Let us work. Let us work together. Take care of yourselves. Take care of yourselves. Eat right. Exercise. Drink water. Let's take care of ourselves because this health thing is all of us. All of us. But the Saint Lucia Labour Party, its history and its record, it's very clear on health. And this administration will take health to higher heights. Thank you, my brothers and sisters.